Hi, I'm Elizabeth Hess. We had a few weeks away from each other, but Julie Pryde, the administrator of the CUPHD, has of course been keeping track of the pandemic. Is it still the only thing that you can think about, Julie, or have you expanded your horizons and there are other public health crises that have crept in?
We're starting to think about other things. We're not taking our eye off of this one, but we definitely are looking at things moving toward the future and what we'll need to do if we need to do uh, additional vaccines, boosters, things like that. So not only that, but what are we going to focus on with all this energy and all these amazing community partnerships after we're totally done with COVID? So there's plenty of work to do.
Illinois is pretty much open now. Health experts remain divided over the new Delta variant and things like that. We're vaccinated, but the possibility that down the road, some of these new variants could not be covered by the vaccines we've received.
Well, I mean, yes, that's always a possibility that the virus can mutate in a way that the vaccine no longer works. Currently, it is effective, and it is effective against the Delta variant as well. The concern with the Delta variant is, let's say in Champaign County, for example, we only have roughly 50% of people vaccinated. That's a lot of people. That's 100,000 more people that are not vaccinated, and that's 100,000 plus people who are not protected. They're not protected against any of the variants of the COVID uh, that are out there. So there is still the possibility, and it's more than a possibility, if people don't get vaccinated, by the time we start moving indoors again, we absolutely will see spikes. What that will mean is that we'll start seeing more hospitalizations and more deaths again. And the way to prevent that is to get vaccinated. And now is a super good time to get vaccinated because there has been the incentive program that was just out, and if you're vaccinated by July 1st, you can take part in the drawing automatically and win up to $1 million. So 10 million in prizes will be given away. So that now's the time to do it.
Of that number of people who are unvaccinated, are you including 0 to 12-year-olds?
Yes, 0 to 12-year-olds are not vaccinated yet, but hopefully by fall there will be a vaccine for them. But it's the same thing. Anyone who isn't vaccinated is going to remain vulnerable. And typically, people cluster together in social groups, social networks, things like that. With if they're unvaccinated, they'll likely have friends as well who are. So. And we'll see, some of the communities that don't have very high vaccination rates. So Champaign-Urbana has higher than 50% vaccination rate, and University of Illinois does. But once you move out more into the county, some areas do not, and they will be vulnerable.
Do you personally have members of your family that are resistant to getting the vaccine? And what are some of the reasons? What are some of the excuses people have given you why they won't?
Sure. I mean, I think it's there's a lot of misinformation, but it's definitely out there. So, number one is that this vaccine is too new. There's not enough known about it. Well, there's actually three vaccines. Two of them are the new technology, the mRNA, which is a new technology, but it's not brand new. The platform has been there, and they've been working on it for over 12 years. The new thing is what is in it now, which is the um, information to prevent COVID-19. So that's new, but the vaccine has been in the works for a very, very long time. The other one, the Johnson and Johnson, is more your standard type of vaccine. So again, there's just a belief that these are somehow, a brand new vaccine, and we don't know what's in it. I keep hearing that. Actually, we do know what's in it. We know what's in all vaccines because it has to be published. And you can go right on to the CUPHD Facebook. There's a great video on there that we've posted from a professor over at the U of I who talks about what's in the vaccines and what the different components do. So So that's one thing. There's beliefs that it can cause infertility and cause all these other problems. And then there was, the issue with the Johnson & Johnson blood clots, even though that's not really been linked. It's been, there were the 6 cases out of, I don't remember, X number of million. I don't remember exactly what it was, but what that should tell you is that the monitoring is extraordinarily sensitive to be able to pick up that few of cases in this many people. And to put that together, and even though they didn't show that there's causation, it's still important that it was able to pick it up. And then obviously it's been since cleared for people to get that as well. So
there are people in both of our lives, though, who won't put it into children, who say we don't know about the long-term effects. Can you say that the minute that it is available to your family, that you would have your great nieces and everybody in your family 0 to 12 vaccinated?
Without a doubt, I would not hesitate 1 minute on this. Again, the things people will pick out is, oh, well, we don't know about the long-term effects. Well, we know about the short-term effects and the long-term effects of COVID, including on children. And it does sometimes include death, and it does include other things that are extremely serious, including heart disease and things like that. It's just not, it's not worth taking that risk. And that is the problem with doing risk assessments. When people do risk assessments, they often look at like one thing rather than looking at the much bigger picture. So we know that there have been over 600,000 deaths from COVID in the United States, yet people will constantly post on our Facebook page, well, did you hear about this person who died after the COVID vaccine? Well, did you hear about the 600,000 that died after getting COVID? I mean, so there's that issue people have with making a risk analysis, and it's very common. It's certainly not just with COVID; it's with all kinds of things. That's the people who are maybe smoking, but they're worried about something that's more obscure. Getting that. We have that when there's different disease outbreaks and things. They'll be worried about the very unlikely chance of catching Legionella, let's say, but yet be smoking 2 packs of cigarettes a day. So the risk analysis for people is just a difficult concept.
99% rate that gets you healthy after that. I get that a lot. It's still 99%. You'll get over it. Do you want to pick the one?
Well, that's not true for one thing, but I mean,
I know I hear that one a lot,
yeah.
But what do you say to that stat?
It's the same thing. I mean, it's just people will look for things that confirm their bias, if you will. So they will just look for things that either aren't true or that is taken out of context or all kinds of things. But but if you ask me, would I give this vaccine to my children, my grandchildren, anybody in my care? Absolutely, including when it's available for babies, because it's kind of the same concept as pregnant women taking the vaccine to then be able to pass on immunity to their infants. It is very important.
The locations now, I know the Dress Barn has closed. My entire family got theirs there. Where can you get them in Champaign County and the surrounding area now? Where can you get the vaccine?
There are so many places that the best thing to do would be to go to vaccines.gov, and this will be ongoing. Plus, that's also wonderful because you can choose what vaccine. So if you want, even if you're like looking for a shingles vaccine, you can click that and it'll tell you all the places in the area you can get that. But if you go on there and you type in COVID, it will ask you, do you want the Moderna? Do you want the Pfizer? Do you want the Johnson & Johnson, or do you not care? You can click 1, 2, 3 of those that you want, and then it will show you every place in our entire county that has those, and then also our surrounding areas. You just type in a zip code. So if you're going to be somewhere else and or your friend lives in, Paducah, Kentucky, you can put that zip code in there and tell them same thing. So it's a great website. So that's going on. And then we're also going to have lots and lots of convenience and pop-up clinics going on. So coming up, there will be, if you look at the park district, if the park district is doing movie nights in the parks, we'll be there doing vaccinations. If there is a festival going on, we're going to be there doing vaccinations. If the county fair is going on, we're going to be there doing vaccinations. So vaccinations are going to be all over the place, and we're going to just keep offering them as many places as we can and as conveniently as we can until we get everybody that we possibly can vaccinated. Especially before fall, it's super important to do this before we go into, another winter, because the unvaccinated people will not be protected, and then we're likely, like I said, to see more hospitalizations and deaths due to that.
You just read my mind. My next question was about hospitalizations and deaths. Mm-hmm. The reason things are opening up is because we did the one thing that we were supposed to do, and that was not overwhelm the healthcare system. Mm-hmm. Currently in Champaign County, how many hospitalizations do we have with COVID-19?
I believe right now we're at 8, but that changes all the time. The thing with Delta variant, which it's not here yet, but it's certainly coming in our area. With Delta variant, it is way more infectious, and it's also hospitalizing more people and causing much more serious illness. So that means that, if you kind of manage to get by without getting it last year, but you're still not vaccinated, you don't have magical protection. You're not magically protected. You're not lucky. You're nothing, because it's coming and it's going to be more infectious. So you are still vulnerable if you're not vaccinated.
Are there any situations that you personally are still wearing a mask?
Yeah, I will wear a mask. There's a lot of things I would wear a mask for. Obviously, with travel, if I were on a plane, I would wear a mask. If I were on something like Amtrak, I would probably wear a mask, just because that basically I'm going to wear a mask any place that I'm told to wear a mask, or that I'm asked to wear a mask. So if I go into a store and they have a sign that says they want everyone wearing masks, I'm going to do that. When I go to the grocery store now, I do not wear a mask. I do not wear a mask when I'm anywhere outside, basically. So because I'm vaccinated, I'm not wearing a mask.
I'm still wearing a mask every time I go into a store or anywhere else. For those of us who have re-emergent anxiety of starting back into the community, do you have any words of wisdom for us?
Well, I mean, the mask, despite all the bizarre things you've heard about masks, it's not hurting anyone to wear a mask at all. I will be wearing one to travel from now on, and not necessarily because of COVID, because I am vaccinated against that, but because there are so many respiratory viruses that go around during the fall and winter that I would prefer not to catch. I actually had a year without any respiratory viruses, which is probably the first time in my entire adult life. So I will be wearing when I travel on public transportation from now on. I will probably also maybe wear them if I'm in crowded situations in the winter. Again, it's not for the vaccine, or it's not for the diseases that I'm already vaccinated against. I'll be doing it to protect myself from other respiratory viruses that I don't really want to get.
Julie, because community transition is down, this is our last show for UPTV. There's still a lot to do in order to combat the pandemic completely. What is the best place going forward for somebody to get information about what to do with COVID-19?
Well, our Facebook page is there. Our website is still there. I'm still here sitting at my desk. I'm going to be in the same spot. I still answer my phone. I answer my email. People can call public health at any time for questions, not just about COVID, but for about any of the programs or services that we provide. And I think, our website's going to be the best place to know what's going on in the community. And on Facebook, we will put flyers up for when there are events popping up during the week for, COVID vaccines. But I'm really, really thankful for this show. I am very thankful that you and Jason took the time to do this, and that Mayor Marlin allowed us to do this. It has allowed me to get out information in a way that I think has been very helpful to a lot of people. And it's been great talking with you guys every week. And So I really appreciate it. And I am glad that we're done with it. Because, if something should happen, it's not like we can't start it back up, but I am glad for things to be tapering off and for people's questions to be answered. And we've got a lot of community support. I get people calling or sending things apologizing for people who are being negative. That's not necessary. That's that's part of the job. I appreciate it. It's not necessary because the community support has easily been 10 times, or if not more, for every negative comment we get. We have a ton of community support, and that has very much been appreciated, not just by myself, but from my entire team. So thank you.
I want to echo what you just said, and Mayor Marlin has been an excellent partner in all of this. Of course, Jason Liggett, our amazing producer at UTV. I'm sad that we won't see you weekly, but I will see you in the future. And Julie Pryde, your staff, what can I say? It's the best in the state, probably in the country, and we wouldn't be where we are without you. And I know that you roll your eyes and you say it's a team effort, but Julie
Yes.
Pryde, administrator of CUPHD, this is all happening, opening up because of you. Thank you. Take the credit. The community, we're not worthy. So thank you.